Why is US healthcare so expensive? Explained for Americans. Hey everyone, welcome back to the channel. Today we're going to talk about a question almost every American has asked at some point. Why is US healthcare so expensive? I'm not just talking about a little expensive. I'm talking about one ER visit and you're terrified to open the bill. Expensive. In this video, I'm going to break down, in simple terms, why US healthcare costs so much, who's getting paid, and what makes America different from other rich countries. This is not a political rant, it's an explainer for regular Americans who just want to understand why is it like this. So, let's start with the basic fact almost everyone agrees on. First, let's get one thing clear. The US doesn't just feel more expensive, it is more expensive. The US spends a higher share of its GDP on healthcare than any other major rich country. We also spend more per person on healthcare than basically anyone else in the developed world. And yet, a lot of Americans are uninsured or underinsured, avoid going to the doctor because of cost, or are one medical emergency away from serious debt. So here's the mystery. How can a country spend so much money on healthcare and still have so many people worried about medical bills? To answer that, let's break it down into 5 main reasons. Prices are just higher here. The system is insanely complex. We rely heavily on private insurance. There's a lot of market power and lobbying. The system often pays for more treatment, not necessarily better health. Let's go one by one. Let's start with the most obvious thing. In the US, the price of almost everything in healthcare is higher. Doctor visits, higher. Hospital stays, way higher. Surgeries, don't even ask. Prescription drugs, often much higher than in other countries. If you've ever seen a hospital bill with $50 for a bandage, $100 for a simple blood test, $1,000+ for an MRI, you know what I'm talking about. Other countries often have some form of price control or negotiation built into the system. Their governments or national health systems bargain with hospitals and drug companies and say, "We're not paying that. Here's the price." In the US, prices are often the result of behind-the-scenes negotiations between hospitals, insurance companies, and drug manufacturers. The problem? Those negotiations are not transparent, and the final prices are often very high, especially for people who are uninsured or out of network. So, reason number 1. We pay more simply because the price tags themselves are higher than in many other countries. Now let's talk about something you don't see directly on your bill: administrative complexity. The US healthcare system is not one system. It's like a bunch of systems stacked on top of each other. Private insurance through your employer, individual plans bought on the marketplace, Medicare, Medicaid, VA care, and people with no insurance at all. Each insurance company has its own network, its own forms, its own billing codes, its own rules for what's covered and what's not. So what does this mean? It means hospitals and clinics need huge billing departments just to deal with paperwork, coding, pre-approvals, claims, appeals, and rebilling. All of that costs money. In many other countries, there's one main payer, or at least a much simpler setup. Fewer types of insurance, more standard rules, and a lot less time spent arguing over who pays what. In the US, a lot of money goes into simply running the system: administrative staff, billing software, claims management, and insurance company overhead. That doesn't directly make you healthier, but you're still paying for it. So, reason number 2. The system is incredibly complex and fragmented, and we spend a lot of money just managing the complexity. In the US, most non-elderly people get healthcare through private insurance, usually from an employer or purchased individually. Private insurance can be helpful, but it also changes incentives. Here's how. Employer-based insurance hides the true cost. You might see your monthly premium and copay, but your employer is also paying a large amount that you never see on your paycheck. So the real cost of your healthcare is often higher than you realize. Insurance companies negotiate different prices with each hospital. That's why the same procedure can cost very different amounts depending on your plan and where you go. People without good insurance get hit the hardest. If you're uninsured or out of network, you might be billed the full list price, which can be outrageously high. High deductibles and copays. Even if you do have insurance, you often have to pay thousands of dollars out of pocket before your insurance really kicks in. Compare this to countries where everyone is automatically covered. There's less worry about being in network or out of network, and people don't live in fear of surprise bills. In the US, the structure of private insurance means more complexity, more negotiation, and often higher prices passed on to you. So, reason number 3. Our heavy reliance on private insurance with complex benefit designs contributes to higher costs and unpredictable bills. Now let's talk about something a bit uncomfortable: power and money. In the US, healthcare is a huge business. Hospitals merge and form big systems. Pharmaceutical companies hold patents and set prices. Insurance companies are massive corporations. When a hospital system buys up multiple clinics and facilities in a region, it gains market power. That means fewer competitors, more control over prices. Similarly, some drug companies have exclusive rights to sell a particular medication for years. Without strong negotiation from a national buyer, they can set very high prices, especially in the US market. On top of that, the healthcare industry spends a lot of money on lobbying, campaign contributions, and influencing policy. This doesn't mean everyone in the system is evil or corrupt, but it does mean that there are strong financial incentives to keep prices high and to resist changes that might reduce profits. So, reason number 4. A lot of powerful players in the system benefit from higher prices, and they have the resources to protect their interests. Finally, let's talk about what we actually pay for. The US is very good at high-tech treatments, complex surgeries, advanced diagnostics. If you're very sick or need a cutting-edge procedure, American medicine can be incredible. But we're not as good at preventive care, managing chronic diseases early, and making sure everyone has access to basic, affordable care. Often, the system rewards doing more procedures, ordering more tests, and performing more billable services, rather than simply keeping people healthy in the first place. So we end up spending a lot of money after people get sick, instead of spending a bit less money to keep people healthy earlier. Other countries often put more focus on primary care, family doctors, and preventive services. So reason number 5. The US system tends to reward more treatment, not necessarily better overall health, and that can drive costs up without always improving outcomes. Let's recap. US healthcare is so expensive because prices are higher for almost everything. The system is complex and fragmented, which adds administrative costs. We rely heavily on private insurance with complicated rules and cost sharing. Large players in the system have market power and strong lobbying influence. The system often rewards more medical activity, not necessarily better health. None of this is your fault as an individual patient, but understanding these reasons helps you see why your bills look the way they do, understand why reforms are so difficult, and realize that you're not bad with money just because a hospital bill wrecks your savings. In many cases, the problem is not you. It's the system you're stuck inside. If you found this breakdown helpful, hit like, subscribe to the channel, and share this video with someone who's ever said, "Why is healthcare in this country so messed up?" In the comments, tell me, what's the most shocking or confusing medical bill you've ever received? And what part of the US healthcare system do you want explained next? Thanks for watching, and I'll see you in the next video.